And about 2 weeks to go before classes start, the Ontario government released a plan of how it will manage COVID-19 outbreaks in schools. The strategy lays out various scenarios for what will happen if a student, educator, or parent shows symptoms or tests positive for the virus. If there's a single positive case, an entire cohort will be sent home to self-isolate. Students can return after 14 days, provided they don't have symptoms. But tests won't be mandatory to return to school. Dr. Dina Kulik is a pediatrician and emergency room physician. She's also the director of medical clinic Kid Crew in Toronto, and she joins us. Good afternoon, Dr. Kulik.
Good afternoon.
What do these guidelines ask parents to do if their child has COVID-like symptoms? I wonder if you could just, walk us through the ways that a case would be handled.
It's a little bit confusing, to be honest, but the report basically says that the principal of that individual school has the onus to determine what to do with that child.
So, expand on that. So if the child, shows symptoms, like what happens step by step after that?
If the child is found to be having any symptoms at the school setting, the principal would then isolate that child on their own, and that child would then be sent home to have this 14 days off. Or if they had testing and the test was negative, they could return 24 hours after symptoms resolved. And any confirmed case, that cohort as well, would have those same criteria of isolation for 14 days.
Wow. So there are so many questions that I have around that. One, I guess, starts with the principal. So it seems to me that the responsibility falls on the principal to make that decision. This is a health decision, I would think. What do you make of that?
Yeah, it's an interesting way to be managing this, right? We're putting so much responsibility in the hands of principals and educators now with this whole return to school program. And these people are not healthcare providers. They are educators and they're administrators. So to put the onus on these principals to decide whether a child should go home or what should happen to that classroom is really quite unfair. And I think it places undue burden. One, they don't have the education. They're not healthcare providers by and large. But also there's going to be a lot of pressure on these principals by the care providers, by the caregivers, because a lot of these caregivers, these parents are going back to work, and some will likely be like, oh yeah, it's not that bad. The child has had a runny nose or had a fever. The fever went away or whatnot. And if the onus is on the principal to decide, there's no real objective criteria here that we're seeing. It's really subjective based on their own experiences or judgment call.
Yeah, I mean, even when you think of the myriad of symptoms and other illnesses that may have similar symptoms, can you give us some advice here on, how would we discern, and at what point do we say, okay, this child needs to be isolated?
I don't believe we can say with certainty what is COVID and what is any other virus. In my experience of the last 6 months, I've taken care of numerous children, hundreds of children, that had any one of viral symptoms. It could be fever. It could be, stomach flu kind of symptoms with vomiting or diarrhea. It could be pink eye. It could be rashes. It could be, cough, cold, runny nose kind of symptoms. And I think all of that should be considered to be COVID because the testing is inaccurate and unreliable, particularly in children. I can say that with 100% certainty. The number of children I've taken care of whose parents tested positive or siblings tested positive, and they had those exact same symptoms, and yet they tested negative. I just don't think we can reliably put our faith in negative COVID testing to determine if a child or an adult has COVID and is at risk of other people.
Even before, though, a child shows symptoms, how do we know that that child doesn't have COVID? Because my understanding is that it's possible for a significant number of young people, children included, to have COVID and be asymptomatic.
That's absolutely true. Most likely, the vast majority of people that have COVID are asymptomatic. Some will end up having testing and test positive. Let's say they were exposed to someone that they know has COVID, or maybe they got tested because they're healthcare providers or whatnot. but there are certainly significant numbers of patients that have COVID that don't know it and have absolutely no symptoms, which is why the concept of social distancing, maintaining our distance, wearing masks, et cetera, is really important, because I don't think anyone can assume that anyone else does not have COVID.
hmm So if we go in with that, then that we adhere to these public health measures, as you say, of the masks, of social distancing, of washing our hands, of following all those guidelines, how safe potentially are we, or are the students, that is, in schools?
I think it depends on the classroom setting, to be honest. We know that in Ontario and in Canada as a whole, we have done very well with COVID compared to many other countries. We know that many daycares and camps have opened over the summer, and yet we have not had a dramatic rise in cases of COVID. And that likely stems from a few things, as you mentioned: minimizing group sizes, wearing masks when important to do so, close, contact settings, et cetera, really diligent hand hygiene, and staying home if you're unwell. The screening that is done, though, when a child goes to a daycare setting is much more significant than what we're discussing now for back to school. In fact, it's quite dichotomous. There's not really a real screening system that can be mandated across the province and across Canada. And groups are likely, in some cases, going to be bigger than 10 or 12 or 15 kids per group. We know these small classes work. We know diligent hand hygiene works and masking when necessary, et cetera. But the school way doesn't look like those same criteria that we're using for daycares. So we don't know. Maybe we'll have a dramatic rise and maybe we will not. But certainly the groups are going to be bigger.
hmm and even though, you say that the tests are faulty, that's what we have. Should parents be taking children for COVID testing?
In general, I don't routinely recommend it. We don't have a gold standard for the test. So there's no way to know at the moment how accurate or reliable it is, because there's nothing to compare it to. If a child tests negative and we're putting a lot of reliance on that test to say whether a child is at risk and transmitted COVID to others, I think we are putting ourselves in a dangerous position. Until we know exactly the statistics on how reliable and accurate these tests are, if we're putting everything about going back to school and daycare in the hands of this test, which I can assure you, and many of my healthcare provider colleagues can assure you, it is not an accurate test. And it also depends when you test. So where you test is important, who does the test is important, and at what point in the illness. Even the children that have done more poorly, the children that have had Kawasaki disease or multi-system inflammation, the sickest of the sick kids, the kids that are getting admitted to hospital, many of these kids are not testing positive for COVID. Some have antibodies, some don't have antibodies. Some have positive COVID screens and some don't. And it depends when you test them as well, at the height of the illness or after the illness or before they're even symptomatic. There's a lot we don't know about the testing yet. So I do think it's unwise to put all of our stock into positive or negative tests to determine whether a child should go back to school or daycare.
I'm also wondering, because the fall, typically, we enter the time of the flu. Does that even really make a difference, trying to differentiate between the flu and COVID, just based on what you said about, symptoms can be indicative of all kinds of different illnesses, including COVID?
Absolutely. It's every viral symptom as far as I'm concerned. A lot of stomach flu symptoms, I'm pretty certain, are COVID. A lot of what we call roseola typically, which we see in young kids, where you have fever for 3 to 5 days and irritability and poor appetite and poor sleep, followed by a rash. We see this very commonly in kids, but typically it requires contact with another child. And I've seen so many children, even during quarantine, that had no contact with other children at all, that got this roseola rash and roseola fever, and yet they weren't exposed to other children. So I think until we have better tests available, we should assume every viral illness is COVID. And look, the argument that we're going to go back in the fall, and in the fall we have more influenza and other viruses. If we're doing a good job at protecting ourselves from COVID, we are doing an excellent job of protecting ourselves from other illnesses. There's no reason why children or adults should be getting other illnesses right now if we're doing what we need to do to protect against COVID, because COVID is likely more contagious than all of these other illnesses.
Mm-hmm.
So there's no reason why people should be getting influenza, because they should be protected against COVID, which is spread the same way.
This is a really difficult challenging time for parents, with the changes happening through the educational system and with the fears of COVID and the unknown of what's going to happen sending their kids to school. What do you recommend that parents do if their children seem unwell with any kind of illness, while they're in school?
I think it's very important that you don't even try to send your child to school if they are in any way unwell. I would definitely suggest a 14-day of isolation. I know that's incredibly challenging for families that are dealing with this burden of, 6 months in of not being able to send your kids to programs or, go to work as we normally do. I know how stressful and anxiety provoking that is. I have 4 young children of my own who are school aged. I get it totally. But if we send our kids that are even a little bit sick, we're going to be increasing the risk that other people get sick. We have to expect there'll be that many more kids that are in schools and daycares that are asymptomatic that could still be passing on COVID. So we accept that there will be people at school that likely have COVID that could potentially pass it on to other people. What we need to take out are the kids that are even a little bit sick because, again, likely that illness is COVID, just given how incredibly contagious it is and how easily it transmits. So I would suggest a 14 days at home. I would not be personally relying on testing. Negative COVID tests, to me, does not mean the child does not have COVID or that the child is not able to pass it on to other people. And I would say, I would even extend that to family members and loved ones. If someone in your bubble has any viral symptoms, regardless of whether they test positive or negative for COVID, or if you even go for the test at all, I personally think those family members too should be isolating for 14 days. This is how we're going to keep the numbers down. Being patient with all this is how we're going to get through this and not have a second or third wave, and how we're not going to put ourselves in a position where we have to quarantine yet again and start again from scratch.
All right.
We want to do this slowly and patiently.
All right. Well, thank you very much for your advice on this, Dr. Kulik.
You are welcome.
That's Dr. Dina Kulik, pediatrician and emergency room physician and the director of the Clinic Kid Group.